Hi, Dr. Rowane. I just saw that patient you asked me to see this morning. Well, you know, she came in just for a blood pressure refill, blood pressure meds, and well, she's complaining now about some heartburn, some bitter taste in her mouth, and she has some tenderness kind of at the top of her epigastric region. So I'm kind of thinking that she probably is having some reflux or something like that. So.
What do you think is going on generally with the patient?
Well, you know, she does seem to be more stressed out than when we normally see her, and she's gained a little weight since the last time she was in. You know, I don't know exactly what's going on, but she did note that her underpants are tighter than normal. So.
And you came with the diagnosis of GERD. Were there other things going on? Were you thinking of anything else that maybe was more significant or concerning?
Oh gosh, well, I mean, I guess I thought briefly about a hernia or something, but I didn't really get, you know, those signs and symptoms. I guess the worst case would be, you know, a tumor of some sort. It kind of sounded just like basic GERD to me.
Well, you're right. In a lot of cases, you try to look and see what are the worst possible things. You know, and you're right. You know, cancer is something you can always think about. Other things, the history may not fully support with that. But also, you know, erosive esophagitis, and sometimes more concerning things. And looking at that, you know, you've noticed also, you said she's gained some weight. How much weight did she gain since you were seeing in the last few months?
Maybe 6 to 8 pounds or so.
You mentioned that she's a little more stressed out. Now, you know, this is also an opportunity to look at this. As osteopathic physicians, we have a little, one of our things is we have a holistic look at people. And above it is, there is, you know, looking at this, the psychosocial aspects themselves. And those things may add into it as well. So we want to keep those things in mind. We also, as physicians, we want to make sure we look at that differential, make sure that we're not getting issues that could be more concerning, like erosive esophagitis, or if she was a risk for a tumor. Even though it's less likely, you always have to think of those things in the back of your head. Also, it's nice to look at the patient and evaluate them. Sometimes in the thoracic region, you'll see areosomatic dysfunction that correlate with GERD, you know. Especially in the mid-thoracic region, we can look at that. One thing I think was good is that you picked up on the things that are kind of going on in life and the changes in her life, and that is, you know, that she had this more stress, you know, that she had kind of gained the weight, and you know, those things may add to the area themselves. One area that, you know, that makes sure it's important is that expand that differential a little bit more, because in looking at those things and think about, you know, do we need to work this up more, you know, with her than we have, and they'll go in and see her with you, and then we can kind of all determine that.
All right, thank you so much.
Okay, let's take a look at the patient.
All right, thanks.